Welcome to Hearing Step to Wellness. I'm Dr. J,
I'm Mei.
your trusted guide to whole person health, one step
And one bite
at a time.
time. Hello, happy Friday.
Friday.
Yeah,
Yep.
love this. So, so
Yes.
what are we going to talk about, Dr. J? It's such a beautiful Friday. We know that you are a podiatrist, but also board certified in lifestyle medicine, and you have been addressing the whole person approach because it sounds like when people come here for the complaint, they may not notice their foot problem or hands. In Minnesota, you are able to treat hands actually related to the body information. And then you normally guide your patient toward the root cause. So can you help us see what the symptoms that normally people will see? I mean, for all this information that people will see on their related to foot and hands show the sign, and how you approach in treating, guiding patient toward the root cause.
Well, number one is really looking at where the pain is,
Mm-hmm.
and then what type of pain or complaint. For example, if that's one big thing about inflammation is dermatitis.
Mm-hmm.
They will have dermatitis on their hands, dermatitis on your legs. That's a very common thing. That's inflammatory responses.
Mm-hmm.
Another thing about the inflammation is at its foot, fungal nails, warts.
Mm-hmm. Mm-hmm.
Those happens. They are highly related to the immunity of the
I
body.
see.
So when a person has chronic inflammation, they
Mm-hmm.
reduce their immunity, and
Mm-hmm.
that's a perfect time for the fungus to show up, for the wart to show up, the virus to get into the
I
skin.
see.
So the fungus is in our socks, in our shoes all the time.
Mm-hmm.
Now, why would it happen at this point? It's
Mm-hmm.
because we have less immunity. The immune
I see.
is weakened by some reason, and that's how we
Mm-hmm.
get there. So besides just giving the topical or anything,
Right.
looking at the immunity is a big thing.
Mm-hmm.
And if someone has ankle pain, joint pains,
Mm-hmm.
or foot pain, they also need to look at the biomechanics, how they
Mm-hmm.
walk, how they move. And as I say, we'll have to treat the root cause, not just
Mm-hmm.
look at that. So when we look at that, and then we look at where else you have the inflammation.
I see.
People say, I have pain on my ankle,
Mm-hmm.
but there's a few things, like osteoarthritis. We used to say it's an old age arthritis. And rheumatoid or gout, that we call it inflammatory arthritis, meaning they have the inflammatory responses inside the joint. But now we realize that, and the research in the last few years found out that osteoarthritis has a lot of inflammatory responses inside too.
Mm-hmm.
May not be as much as rheumatoid or inflammatory type of arthritis, but they still have a lot of inflammatory responses in there. So what does it mean is when you have a local issue, for example, you're walking abnormal, you are putting too much weight in certain spot of your joint, and that injury create local inflammation. But at the same time, if your body has systemic inflammation, those inflammatory molecules circling our body could go to the joint
I see.
and create further damage, accelerate this process to worsen the osteoarthritis. So anything like that, we will treat not just the local inflammation, but
I
we
see.
also want to look at the systemic inflammation. Make sure there's no excessive systemic inflammation coming to the joint to damage the joint. So that's another thing. And another situation is that people talk about fibromyalgia
I see.
or ankle sprain or any tendon pain or unknown pain. When you have pain more than 3 months, we call it chronic pain.
Chronic.
A lot of time we have the we could call it centralization, meaning this signal goes to your brain so often, so persistent now your brain is inflamed. And just what happens that we talk about the bruise at the beginning. When you had the bruise there, whatever you, no matter how you touch it, it's painful.
Mm-hmm.
And so it's the same thing after a long period of chronic pain. Your brain is inflamed. The nerves inside your brain are inflamed. And now it's much easier for you to have that pain because they're hypersensitive now.
Mm-hmm.
So it's easier for you to continue to have pain in the area or develop new pain in other areas
Mm-hmm.
or other neurological symptoms, brain fog or anything coming in at the same time.
Mm-hmm.
And that's why whenever there's a chronic pain, the treatment is a bit different.
Mm-hmm.
And
I also, since you touch about the autoimmune autoimmune illness, the one of the very common one is lupus. Talking about the symptom on the skin. So if people show, so the lupus related to the autoimmune response.
mhm,
So 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 it looks like to me, it's not only going to be one place, probably will show multiple spots in your body,
right.
like in the foot, and that's why I like very much about your approach is when you see maybe a first sign, I don't know whether that's possible, just to show on the foot as a first sign, on the hand as first sign, but you kind of dive into that and see, this is, this is truly your autoimmune response, and you help a patient to dive into treat the root causes so that will resolve, will actually maybe reduce the symptom
Mm.
and help them get better. So when we come to the point when it's a bigger than the traditional, just like in traditional medicine, just like treating the symptom, what is your approach to help people dive in further, incorporate the functional medicine beyond the lifestyle as a foundation?
Functional medicine in one aspect is a very good diagnostic tool. So it do the testing based on the system. And that's why it's much easier to treat, to find the root cause. No, and after that, I always go back to lifestyle medicine as a foundation.
Mm-hmm.
No, we find the cause, we want to build based on a lifestyle. It's not only that it's more sustainable, it's the right way, but as I said, it's really more sustainable. I don't want people to feel that they can only treat their problem with medication or with supplements.
Mm-hmm.
Now, some supplements, vitamins are essential that we have to take, but the vast majority we may not need it. If you go into this treatment plan relying on supplements, it make it become a privilege to have health. No, what if you cannot afford to buy those supplements? Are you going to give up on your health?
Mm-hmm. Yeah, that's a good
Then
point.
it's not sustainable.
Mm-hmm. So you talk about some essential supplement when our body need that and we need to boost that.
Mm-hmm.
I also heard some people they were advised to take the supplement related to like a fiber,
Oh.
fruit, veggie. What is your take on that?
Um, why you buy those when you just get them from food?
That's a good point.
So there's a few things. Number one, they say, oh, it's minimally processed. It's still processed. No, no matter what, during your process, just think about you get from fruit, vegetable, and you want to dry them. Just the process, just this simple process, how much how much vitamins are destroyed
Hmm.
during this process.
Right, right,
So no matter what, you're not getting the full nutrient
right,
from the food. And number
right.
two, They said you should have fibers. But think about, you have the vegetables, they're big, and now you put into the peel or a powder.
Mm-hmm.
How small the fibers are now. It's
Right.
being chopped so fine.
Right.
You're more similar to the soluble fibers, not the
Mm-hmm.
really the insoluble fibers that body
Mhm.
cannot digest. That
Mhm.
type is the one that really go into your GI, in your GI system, clean up all those waste,
Mhm.
create a ball, and help you go through the bowel movement,
Right.
all of that. So you are missing a lot. Not to mention they're more expensive than you can just buy from the farmer's market.
Mhm.
So unless you really have issue chewing
Mhm.
or eating, I really still prefer to get the real food.
But even though people have, if they have a hard time to chew food, they still can use a blender to make a smoothie. You chuck
But
it, you chuck up the 8 ounces or more is more like a healthy drink that you can drink multiple times a day.
mhm,
So you intake the real fiber, the real food, you just chop them finely, allow you to digest them better still.
right,
Mm.
right. So we don't get paid by um Vitamix. They should, but
Yeah.
so that's a good thing that you can create similar thing by using Vitamix. But at the same time, it's just like you're creating small fibers,
Hmm.
small chunks.
Yep.
So when you take the supplements or when you're drinking out of that smoothie, it's still easier for you get the insulin spike
Hmm.
because now it's a lot easier for the body to absorb. So it's
Hmm.
a good thing, but it should not be your main thing.
Hmm.
Yeah.
Hmm. Okay. So now we are talking about the healthy eating, healthy lifestyle. When we're talking about a chronic disease, there's associated with several diseases that uh, like heart disease, hypertension. Now, when patients come to you
Mm.
and they develop the acute inflammation versus a chronic inflammation, you have a different approach. Let's talk about the when you help a patient to calm down their inflammation. Um, how do you use the other modality other than the lifestyle intervention because that take time? But if the people really are, they are in pain, they
Mm.
need, and then they trigger the psychological emotional health as well because it's just the pain sometimes is get in the way to adapt a healthy movement. It's just so painful to exercise. How do you help people to ease the pain and allow them to adapt the movement start from that very baby steps?
Well, as far as I know, not many people like needles. So I try not to use needles. And the best modality I have right now, I found, is laser. There's a different classes of laser based on their intensity.
Mm-hmm.
And the strongest one in the market that require FDA approval and also in the medical office is called class 4
Mm-hmm.
laser. That is the strongest laser. And the laser is not just providing heat. Now, of course, you can have the heat, but it's the energy that go into the cellular level. It goes into the mitochondria to stimulate the mitochondria to produce more ATP for the body to heal, provide
Mm-hmm.
energy for the body to heal, to regenerate. So that is what I use the most. And for example, I got a patient coming in just a few days ago with pain under the knee. They're coming from knee surgery.
Mm-hmm.
And she was putting the pain as 10 out of 10.
Mm-hmm.
And after 10 minutes of treatment, it went down to 6. Not completely resolved, but that's 40% improvement,
Mm-hmm.
better than what she has been able to do in the last 2 years.
So hold on, hold on. So are you saying that the laser treatment allow patient to reduce the pain by 4 level without the needle, without seeing the blood,
Mhm.
without any painful procedure.
Mhm.
And then utilize the heat and just within 10 minutes.
Yes. Yeah. And then
Wow.
we had another case coming in, patient coming in with foot pain, and after 5 minutes treatment, walk out pain-free.
I also can utilize one of my examples, well, my recent incident. Like you mentioned, I had a bug bite and I swallowed my hot, firm, and when I touch it, it's just an unbearable pain. That
Mhm.
teeny tiny bug just did a lot of inflammation on my foot.
Mhm.
And you helped me put on the laser treatment for, I don't know, 10 minutes. And that's a total 4 times within 3 days. And
Mhm.
it reduced the inflammation to very dramatically, and also reduce the redness
Mhm.
level dramatically. So I have to say that it's truly improved my quality of life, because at the time I feel like I want to move, and I also had the vacation event coming up. I didn't want to deal with the inflamed pan, so that really worked out very well before the vacation time.
Right, right. So as I mentioned, that bug bite, you have the protein, you have the wound, it might have bacteria inside. So there's a lot of information and a lot of swelling right there, water
Yes.
retention,
Yep.
and that is coming from. That's why it's painful and it's firm like that. So I use the laser for two main purposes.
Mm-hmm.
Number one is to reduce the swelling. You
Mm-hmm.
want to reduce swelling, you have to improve how the fluid goes back to the heart. So the lymphatic system. So I open up your lymphatic system along your leg,
Mm-hmm.
going back to the heart. So that's how the one. And number two is at the beginning, I use the laser, use the high heat to go over your bite
Mm-hmm.
and try to destroy any protein from there. So the protein from the bug or something there, I use a high heat to denature, to
Mm-hmm.
destroy the protein. And
Mm-hmm.
so that can reduce the inflammatory responses phase.
And I have to say that I had this kind of incident pretty much recurring every year. In the past, the only path given was using the antibiotic to calm it down. But this
Mhm.
time, I'm so grateful I don't need to take an antibiotic, because I know antibiotic can do some damage to my healthy gut
Microbiome.
microbiome.
Yeah.
Yes, I don't want to disturb that. So, yeah, so that is a great approach, and I'm
Right.
truly grateful for that non-invasive treatment method. It
Right,
worth it.
right. So besides the laser, there are a lot more modality now. Peptides is the one that in the
Mm-hmm.
news right now, and
Mm-hmm.
also we call it stem cells. They don't have the live cells inside, but they still have some products like the
Mm-hmm.
protein, growth factors, or all of that. Those can be used to do the local injection to reduce inflammation right away, and
Mm-hmm.
then start to regenerate.
Now, speaking of that, can you give us kind of take us to that direction a little bit, like right now in the in during the summertime, we're talking about the athlete,
Mhm.
people, either professional athlete or people just ready to get on the sports mode and move more. And we also see some information related to foot issue or hand issue, and how you use, like you mentioned about um uh the uh the other modality, which is the stem cell. and how you help reduce the pain and allow people to catch up their activity quick.
The I think the most common one people hear about is PRP,
Okay.
platelet-rich plasma.
Mm-hmm.
So when we have any injury, we form a clot, and the
Mm-hmm.
clot is formed by the platelets. And
Mm-hmm.
so essentially, platelets are the one to initiate all the wound healing process.
Let's see.
And so people figure out that they can draw your blood, concentrate the platelet layer, and
Yeah.
then use that to inject to the injury site, intended site.
Mm-hmm.
And because of the high concentration of platelet, and it will simulate and induce a wound healing process.
Mm-hmm.
And it was developed for professional athletes before,
Mm-hmm.
and you may heard of some of them that they inject on their neck, into the Achilles tendon, knees, that used to be several $1,000s a shot.
Mm-hmm.
Now it's very affordable. People even use that for athletic. For example, they do it on their face. They call it vampire facelift
Mm-hmm.
to do the athletic type. The only thing you wanna consider is number one, it still need to take blood from you.
Mm-hmm.
Number two, their job is to induce inflammation
Right.
because platelet wound healing process inflammation. If you are having pain already, and then you inject PRP to the area,
Mm-hmm.
you are going to have a lot of pain in the next 2-3 days.
Mm-hmm.
And you need to make sure, remember, you don't take any anti-inflammatory medication. A
Mm-hmm.
lot of pain pills are anti-inflammatory.
Mm-hmm.
But when you have PRP injection, you don't do that
Mm-hmm.
because they will tamp down, they will block the functions of the PRP. So
Mm-hmm.
you're going to in pain for the next few days.
I
There's
see.
something you have to keep in mind.
Mm-hmm.
No, there is very common protocol that written for providers to remind providers that you have to tell your patient
Okay.
you're going to be in pain.
Okay.
I learned in the hard way when I asked our family doctor to inject it
Your
into
thumb.
my thumb, so I could learn the process. It was painful,
Mm-hmm.
not from the injection, but from the inflammatory
Mm-hmm.
responses 2-3 days after the injections.
Mm-hmm.
That's something you have to know. And the second thing people now using are from the placenta.
Mm-hmm.
No, the placenta that is usually it's got discarded, but now the FDA approved for them to for company to process it to make products. And the most common product we use is to use that as a wound dressing to
Mm-hmm.
improve the chronic wound healing. And but then it's not for the general population, a lot of things. And so they found out that there's a lot of regenerative material inside the umbilical cord. That's the one that's providing all the nutrients to babies from mom. And then they were able to harvest all those products
Mm-hmm.
from the umbilical cord. And
Mm-hmm.
that is what we're using for a lot of regenerative practice right now.
Mm-hmm.
And
Mm-hmm.
there's also a few things you have to consider. It's really based on what tissue you are trying to heal.
I
So
see.
there are four main types of collagens: type 1, type 2, type 3, and type 4. Type 4
Mm-hmm.
is more the skin, basement membrane, type 4. And type 1 and 3 are more in the tendon,
Mm-hmm.
ligament, that type of injury. And the arthritis cartilage is type 2. So you really need to see what type of tissues you're trying to heal, and
Mm-hmm.
whether it's coming from the PRP or it's coming from the umbilical cord. So you
Mm-hmm.
have to know that
Mm-hmm.
and mix all some products together. You may not achieve your goal, and also reduce with lower pain by using one
Mm-hmm.
product. Sometimes you have to mix some products together to
Mm-hmm.
give you the
Mm-hmm.
best result. But no
Right.
matter what we use, I always like to use a laser.
Mm-hmm.
Use the lasers to reduce the pain and
Mm-hmm.
open up the circulation in the
Mm-hmm.
area
Mm-hmm.
before I do that type of injection.
Mm-hmm.
And that will increase the success rate. But at the
Mm-hmm.
same time, just as simple as reduce the pain during the process.
Right. That actually reduce the pain. Um, I feel like it is the number one need that when people are, or people are suffering from pain,
Mm-hmm.
you will be a lifesaver for people to really be pain free at this for that first cycle, and then continue to adopt the longer term
Mm-hmm.
of a healthy modality. But also, kind of out of curiosity, I know that we are running out of time. For the stem cell, what kind of condition actually is suitable for using the stem cell? And so people can keep in mind, they have an option, they have a hope.
Injuries,
Okay.
acute and chronic injuries, tendonitis, plantar fasciitis, arthritis, all of
Mhm.
that. That's a very good thing to do.
Okay.
Um, and it depends on how you want to apply it. No, you
Mhm.
could do that local injections.
Mhm.
You could going through your nose, going through
Mhm.
IV, or all of
Mhm.
that. But it has to be done by a licensed provider.
Mhm.
So all of that, and so those are coming conditions that they'll benefit from
Mhm.
doing the stem cells.
Right. And I truly, I know my heart, and not because we I mean, I admire that from a professional standpoint, that you would not apply anything that will cause harm to people. You will
Hmm.
use the treatment modality to your families, your
Hmm.
family members, for a long run, um for their best interest. So this is one thing that I truly feel very comfortable, and I also want our patients and people who listen to our podcast, that we will treat people the way how we treat our family and ourselves, and
Right.
so we all have a peace of mind.
Yeah. Yeah.
Mhm.
So
Okay.
let's review today. What I talk about the difference of acute versus chronic inflammation. So acute is good, healthy, that we need it to repair an injury. And the chronic is the thing that we don't want it.
Mhm.
They'll cause a lot of chronic conditions tied to the most common metabolic diseases, like heart disease, diabetes, weight gain, your brain fog, all of that is coming from
Mhm.
there. And
Yeah.
then the most common sources of inflammation from our food, from our
Mhm.
sleep, from our stress, from our lack of activities. And we haven't really touched the environmental yet.
Mhm.
Now, also from alcohol and cigarettes.
Mhm.
So we're gonna cut down on those. And how we treat people with the chronic systemic inflammation is number one is look at your food.
Yeah.
And then make sure you have enough sleep, the good quality sleep, not just quantity, but good quality sleep. Manage your stress. We're not able to be stress free unless
Mhm.
we're 6 feet under. So we want to manage our stress. And if that's a more localized or anything beyond the chronic thing that we can do, then there will be the more the stem cells,
Mhm.
regenerative modalities, the laser, peptides, stem cell derivatives, things that we can do
Mhm.
to
Mhm.
really cut down the inflammation and
Mhm.
help body repair and regenerate.
Mhm. Yeah. Well, thank you very much. And well, I think there are a lot of topics that you can share with
Mm-hmm.
our listener, and also people in our community, your patients. And
Yep.
this is truly a great educational channel for people to learn more about the information.
Yep.
And I know there's one topic you dare not to touch it today, because it is going to have, we need to have a longer time to talk about it, which is women and their foot health. That
Yes.
also a big topic
Yeah.
right now.
We'll talk about that. Yes.
Yeah,
Yes. And anyone has any questions? Send in a question in the chat room.
right.
I'll answer everyone, or go to rochesterclinic.com or our nonprofit lotushealthfoundation.org. Get more information, ask question from there. We're more than happy to answer the question.
Definitely. Yeah, we will put a link in the chat, on this episode. And so we look forward to some suggestion of their favorite topics so we can
Yep,
put them on the schedule.
that's right. You can suggest topics too. Yeah,
Yeah.
women's
Okay.
health. Yeah,
Yeah, I would love to hear that very soon because that is truly a very interesting topic that maybe a lot of people they had never heard about it.
sure. Okay. Thanks for joining us and hearing Step to Wellness. I'm Dr. J,
I'm May,
guiding you to whole person health one step.
and one bite at a time.
See you next time.
Bye.
Bye.
Healing steps to wellness. One step, one bite each day.